Hi, Dr. Victor Ngani once again, and this time I'm inviting us to discuss something critically important, and this is what it will take to strengthen health systems across all the 47 counties and even in the national government. Now, healthcare is supremely important. The first thing we acknowledge is that if you're unwell, you cannot produce, and if you cannot produce, then there is increased dependency and the economy suffers. The second thing is that just general lack of good health is a big strain just in the quality of life. And finally, many families are being driven into poverty because of healthcare expenditure that comes out of pocket, and by far that's been a big contributor to poverty in this country. You could have worked your entire life, but one illness in ICU makes you sell everything, and you leave everybody else in poverty, and even yourself, your life after that becomes difficult. So we can do something to change that. I believe it's possible within existing resources, and perhaps then go a little bit further and invest a bit more in the same space and achieve greater results. Now, in 2007, the World Health Organization developed a framework really that breaks down the health systems into 6 building blocks. I'll talk about 3 or 4 of these, which I think are the most significant. In totality, just for completeness sake, the 6 blocks would include leadership and governance, service delivery, human resources for health, that is a health workforce, the medical products and supplies and technologies, healthcare financing, and healthcare information. These are the main factors. They are those who make them 7 in total. So I'll start with leadership, because we are at that space where it's time to appoint leaders in the respective areas, different levels, to manage healthcare organizations, institutions, governments, and areas of responsibility. Traditionally, what we do is we take these positions to reward those who have been loyal and those who have been supportive. I want to put it across that may be a mistake, because eventually what you are looking to do as a political person is to deliver on a promise that you have made. And the best chance of delivery is to place in those spaces people who are sort of employees whom you can hold accountable, and people who have a track record of delivery in those spaces. Now, I know that may be a bit unpopular amongst the people who have been supportive, because it's a departure from the past, but that departure from the past is what Kenya needs today. And I want to pray that anybody who understands a politician's vision, who actually buys into transformative agenda, will support that, and it's a good test. So what I'm saying is you may have someone who's been extremely loyal, who's an expert in that particular area. Well and good, that person becomes a good leader there. But then if they're not an expert in that area, then maybe to be understanding to allow you to make an appointment into those spaces where you have competence. Now, the second question relates to an old age question. Should we have a manager or a doctor in the place of authority? Now, those are important responsibilities, but I want us to look at it slightly differently. What are we looking for? We are looking for someone who can make critical decisions and drive transformation. So at the bottom of that, the person in that sector must understand the issues around that sector. Now, it does not have to be a doctor. So the convention around it being a doctor, I think that is misplaced. It can be anybody in the health sector who has a health background. Yes, it's said that doctors are the team leaders, whatnot. Not so in leadership per se. The person, however, must, as a necessity, understand healthcare. Therefore, it could be a nurse, could be a clinical officer, someone in the clinical field, could be a doctor, but this is a person who understands the differences. Why is this important? Consider this possibility that you're discussing some difficulties in IT, where a decision has to be made, which IT system to go with. Yes, you'll have advisors, but isn't it more productive when the person being advised already understands the basics of IT, they fully understand how IT works, and therefore they're barely comparing 2 different opinions and being advised appropriately. The same applies to healthcare. It's better when you tell me about CyberKnife, I know what it is to start with, and I can make a decision whether there's an alternative. I can actually listen to this input and listen to this input and put that together, not be in a place where I'm completely blind and 2 different people are trying to make arguments. The chances are I'll go with the more eloquent person as opposed to the person who has a better point, because I do not have the underlying knowledge. The converse is true. If you choose people who understand healthcare in those spaces, then the decisions are much easier, and the advice actually enriches what they already have. It's not to create new knowledge in a place where there's a vacuum, and that's a lot difficult for a country. I hope that makes sense, and I hope we all understand and believe that is true. It is the case. It's hard to have a non-lawyer leading the judicial system, hard to have a non-banker lead the banking system, and an engineer lead engineering in a particular point. Human bodies are much more complex than any of those. Therefore, therefore having a medical person in that space is important. But being a medical person is not the end of the story. The medical person being in charge has to have the ability to lead, meaning that they must also be a manager. So those two factors are actually important. A leader who can understand the area but also has a track record of leadership. Not only that, you must also have history. Now, the way we gauge ability to lead is slightly different. In my view, we ought not pay too much attention to whether I'm a professor in some form of surgery or I have a PhD from the University of Mass or whatever it is. Look at what I've done in terms of leadership. You look at have I transformed anything? Have I changed anything? Because those are more practical and more useful. Our education, those are inputs, but what have I done with that education? You may find that someone who has a diploma does far better in leadership because you can see the transformation they've made in society as compared to somebody who has 2 or 3 PhDs. I think it's very important for us to look at it in that light. So the other part is then the qualities and the attributes of this leader. And I've alluded to 2 possibilities, one relating to ability. The first is that they must have a passion for what they're doing, the passion for the sector. How will you know that? Because if you look at the history, you'll find areas in time when they've tried to make a difference in those spaces where they've been able to pick up a problem in society relating to that particular topic and worked on it. Because where someone puts in their effort, that is a place where the heart is. And therefore, getting somebody from a place where the interest is different into a space where they're trying to transform, this is, by the way, it's a job. They'll not be passionate about it. But if you find someone who lives day in, day out to transform healthcare, chances are they'll enjoy actually bringing about transformation. Number 2, they'll have experience in doing it, and it will definitely be very useful. So passion is one of the first things you're looking at there. The second item is integrity. And integrity goes without saying. It's something that we speak about a lot, but rarely have in those offices. Integrity, lack of integrity is what allows us to have contracts given to friends, and that costs the whole society. So I leave it at that, because integrity would really allow the resources allocated, and they're not too much, to be better utilized. One of the reasons why the resources we have, they're significant, but they don't actually impact healthcare as they should, is because of lack of integrity. I think we can agree on that. Vision. Do you understand and know that it's possible for the public sector to actually surpass the private sector in healthcare in this country today? Do you believe it? It's true, actually, and it's already happening. If you look at the cancer center that has been created in KU Hospital, for example, look at the leaders there. The director of that particular unit is fantastic, and you can see what a vision can be transformed to if you have, that vision alone is a factor in the progress that has been seen in that organization. If you look at Moi Teaching and Referral Hospital, for example, and you'll see it has the leading dialysis center in this country. They lead the country in terms of kidney transplants, a fairly advanced process. So it's very possible that if you have leaders with a vision, then the next space is going to be much better. So then the fourth component of this leader has to be ability. Ability then is measured not by my qualifications, but my track record in terms of leadership in healthcare. What have I done? What have I achieved? And what have you seen? Now I'm adding an S. I used to talk about the PIVA leader, which is what I was speaking about: passion, integrity, vision, and ability. But I'm adding an S to it. Now S stands for spiritually grounded. Now I know, just hear me out for a moment. I know a lot of us have had access to the internet, and we've come across all this knowledge, and we feel that we've known everything there is to know in the world, and there's no God. That's the perception some people have come up across. I'm convinced firmly that you're wrong. God exists, and the internet may mislead you. I want to just put that out there. And so allow me, even as I explain why spiritual grounding is important, and this is purely biblical, where when the Israelites had a good leader who honored God, then the people prospered. But whenever the converse was true, then there was drought, there was famine, and the people really suffered. And therefore, PIVAS is an important acronym for the kind of leader we want in the health sector. Can we do that? Let's choose people who are PIVAS leaders, put them in those spaces, and then just watch healthcare transform. Leadership is super important. The second component relates to human resources for health, the health workforce. And here there are two things, two separate segments. There is need for transformation within the healthcare workforce itself. The first of this is that there has to be a recommitment from every single person who works in the public sector right now. The first commitment is that we will work at least 40 hours a week. We'll actually engage and give, because there is the reality, which is that many of these healthcare workers are just not there. And it's not right. It's actually like theft, and it's contributing to mortalities and putting families in a difficult space. So if you have a job at a public facility, would you commit to give at least 40 hours a week? Now that commitment, that accountability, yes, there is the motivation and the inspiration to go ahead and do it, but also the leaders who are then appointed in the respective counties must start by holding healthcare workers accountable. It is not because we are doctors or nurses or clinical officers or laboratory technologists that we are important. It's because of what we do. And therefore, the guard at the gate is of greater importance to that hospital than the neurosurgeon who's never there. You understand? And so this is one area we just have to change, either willingly together or with resultant consequences as a matter of priority. The second area is just how we offer service. And the reality is that you can see a situation where service is offered one way in a private hospital by the same person and differently in a public sector. Can we change that? Can we understand that we respect people for who they are regardless of their circumstances? And if we commit to then be humble and be servants in that space, then the experience in the public hospitals will be much better. If we actually put in care and compassion in those spaces, the more vulnerable the person is, the greater the impact of what you put in just being humane towards the patients in the public hospitals as well. That goes a long way in healing, goes a long way in transforming our sector. And so it's important for us as healthcare workers to just have a shift in attitude. It's not everybody who has a problem there, but it's generally a cultural situation that needs to be addressed and addressed wholesomely. And it has to be a priority as well that we focus on and ensure that the experience in those hospitals makes sense, that anyone who's there is treated with respect. As I say that, there is this notion again, I've seen the extreme of it, where the healthcare worker is not respected and people will come into the facility and they will talk rudely. I also want to speak against that. I think if you do that, then you have not understood at all what your responsibility is as a citizen. The third item that we'll then talk about is then the numbers, because as of today we have unemployed doctors and unemployed nurses, and if you look at the Western countries, they've understood that Kenyan healthcare workers are actually very well trained. You may not know it because you listen a lot to the internet and opinions of people who may not understand healthcare perfectly well, but the reality is whichever country you go to, whether it's the UK, the US, Britain, Australia, you'll find numerous Kenyan doctors and nurses. You look it up, just go out and find out. In fact, some of the best doctors that you find there are doctors who you'd consider maybe were either middle to, in those spaces as well. So it's just that they've been appreciated far from their homes. Prophets are not, far from their homes, they are appreciated. So can we begin to retain these people in our own society and allow them to work for our communities? It also means that we have to be a little bit more deliberate about how we treat them. So one just great disservice I've never understood is how anybody can find it okay to pay a Cuban surgeon 8 times what you're paying a Kenyan surgeon. I'm happy that we have Cuban doctors. I think we need more doctors in the country in general, but why would you pay somebody else 4 times more because they are not Kenyan? I think that kind of inferiority is something we need to do away with, to understand that we are worth every, we are good enough as a people and begin to treat each other the same. Would you be okay if a foreigner coming into your space doing the exact same work you're doing earns 4 times more? What is the logic behind it? But in fact, it tells you that it's possible to reward our work appropriately. The other factor is that since 2013, since devolution, there has been significant strains across all counties. There are counties that have done very, very well, but the strain has been not in devolution itself. Devolution is a good thing, and I really recommend that healthcare remains devolved. But for healthcare to remain devolved effectively, one challenge has to be addressed, and that is a human resource component. And the best way to address it is to have an independent body, independent, not a national body, but an independent body that handles human resources for health. Now, initially, I think a couple of commissioners from the initial commissions who hadn't really understood fully their responsibilities determined that this was anti-devolution. It's not. In Bomas itself, go back and check, when devolution was being conceived, the founders of devolution said, devolve healthcare and create a health services commission. Why? They foresaw this challenge that then came about. Now, this challenge ended up being because after Bomas, there was a period when politicians sat in Naivasha and they did a couple of things. The first is to increase the number of counties from 14 to 47, and then to remove the HSC. And therefore, the HSC is not anti-devolution, it's actually an adjunct to devolution. Had it been there from 2013, healthcare devolution would have gone much, much smoother. And I think it's not too late for us to go back and just make that slight tweak and see, give ourselves hope for a new dawn. It's possible. The other area I would like to talk about relates to the supplies. And I think right now, it's important for everyone to understand that we are really killing ourselves by the cost of the things that you're buying. And there are people who have been tasked with responsibilities of ensuring that we are buying things efficiently and at affordable prices, but they've slept on the job, or they have just been complicit, because some of the drugs you're buying in the country today, the costs are about 3-4 times more than the cost what it should be. And that has to be dealt with appropriately. Otherwise, for every 1,000 shillings that we invest in healthcare, 2/3 of it is going into the middlemen who are profiting unnecessarily, while the actual cost is just about 1/3 or 1/4 of that cost. Addressing that goes along, of course, with the same issue of integrity being looked into to ensure that we are not losing money to corrupt deals and so on. So if this is done, then there's significant progress to be had in that space also. In terms of infrastructure, I'm hearing counties are building hospitals worth billions of shillings. That is a terrible waste of money. You have to build hospitals, yes, but you're probably building a hospital at about 2 or 3 times the cost of the actual cost. Talk to I'd recommend my CEO and boss, ask him how he's building the hospitals he's building at the amounts of money that he's building. It's the same country. It doesn't mean that because it's public, it has to cost 4 times more. Can we just be responsible enough to utilize those resources and actually make make good use of those returns? Yes, it's a hospital, but it doesn't mean that because it's a hospital, then the cost of one brick of for building costs about 6 times more. It doesn't. It just means something different. In terms of the technologies that we buy, it's very important to understand there's a big difference in the technologies themselves. You can have a CT scan in County A and a CT scan in County B, but the CT scans are vastly different. And this is another area why it's important to have the leaders themselves understand healthcare. You have radiotherapy machine in one area and a similar setup somewhere, but they're vastly different. Those differences are important. You may be paying premium rates for poor quality items, and therefore they are not able to serve. You could have equipment that you bring and put into the hospitals, but then after a few months they're out of service and cannot be repaired because of very many things to consider in that space. And therefore the issues of what you're procuring, there has to be a robust team that can guarantee that these things are serviceable, they're of good quality, and that the price is right. I'm highlighting some of those areas because they're super important. There are many other areas as well, and I want to just, you can reach out to me at any point, and I'm able to assist and just advise on a couple of these areas because it's important for you as a governor, for you as any leader in any space, to actually leave a legacy for yourself on healthcare using the existing resources. Now, just a word on NHIF. NHIF and KEMSA are super important components of this health system. To understand that NHIF is ours collectively. It is not individual property. It is not sort of some free-for-all government place where funds can be taken for free, and therefore it's something we should safeguard jealously and ensure it progresses and prospers. But NHIF, in terms of the officers who work there, should also understand that they've been entrusted with the responsibility to hold brief for all of us, because we can't all make decisions, but that organization itself has to be responsive to the needs of the people. So you protect NHIF, but also NHIF puts at its foremost the need to ensure that the public is served, not to save money as as such, but to be sustainable, and in that sustainability enable a coverage of more be responsive in terms of the needs that the people have. An example is this: there's been this debate of whether NHIF should go into private hospitals or not. That's a redundant debate that makes no sense at all. Look, NHIF should say that if I'm doing a hip replacement, NHF will pay for you 350,000. Now it's up to you to choose where you're going. If you go to a hostel, public hostel, where the 350,000 is enough, great. If you opt to go to a private hospital, like where I work now, I have to add it here, RFH Healthcare right now, if you have NHIF, we'll sort you out surgically within what NHIF approves. Good for you. But if you choose to go to a hospital that will charge you 2 million shillings for it, then you get ready to top up. NHIF as an organization will pay 350,000. And I think that is the direction you should take, where the benefits are standard across wherever you go to, then where you go to is up to you in terms of choice. But to tell the mwananchi that you cannot go to a better facility, I think that is missing the point. The people have to choose where they're going to go to. NHIF defines the package, and then the people choose what is responsive for many reasons. Because at some point, the public system works, at some point it doesn't work. And healthcare, illness will not wait, and there's no point in telling someone that they have to go back to their pocket despite having paid for NHIF on a service that NHIF is currently catering for. Does it make sense? I want to believe that is the case. And as I've said, there are big differences. Some of currently the radiotherapy machines in some private hospitals are much better than some of the systems in some public hospitals. Of course, KU right now has the best systems for cancer treatment in this country. I'll give them that, and it's important for people to understand that and perhaps even then just use that service. It's possible to make the public system better, but these institutions must work for the people. So allow me to leave it at that. You can follow me at Ovngani, that is OVNGANI. And you can also at the same time follow me on Twitter and Facebook, whatever. Just find me there, leave a comment on this video, and